Hello, I'm Andy Burnham. I'm Shadow Health Secretary. It's obviously to shadow the Secretary of State for Health and all that he does and all of his responsibilities. And my responsibility, if you like, my constitutional responsibility is to challenge him and the department to hold them to account for decisions that are taken, and obviously that's an important constitutional responsibility that I have, and I intend to take it very seriously indeed. Well, I believe the government has been responsible for a fundamental breach of trust on the National Health Service. Before the election, Mr Cameron and Mr Lansley stood before many audiences making lots of promises on the health service, not least to midwives, and they haven't delivered. Indeed, I would go so far as to say that they were quite cynical promises to reposition the Tory party, to detoxify the Tory brand on the NHS, that really there was no intention of them ever being delivered. So there is plenty for me to challenge, but obviously the big picture challenge is the bill that's currently in the House of Lords. If it goes through, it is my judgment that our National Health Service will never be the same again. I do, because it goes to the heart of how the government can deliver the promises that I mentioned earlier that they made pre-election. In an NHS where there isn't the ability to set national standards and targets, how can they possibly deliver their commitment of 3,000 extra midwives if the ideology of this bill is basically to say at every local level people can make their own decisions? How can politicians stand there anymore and make promises of that kind? So I think that is what I believe to be the fundamental incoherence at the heart of Conservative health policy. They've wanted to make these big grandstanding commitments on the NHS, but then they've brought through a reform which basically means that they won't have the levers to deliver these things. And we're already seeing decisions now in the National Health Service that are damaging the midwifery profession. So I think this goes to the heart of their incoherence on the NHS, and is why I think in the end they will pay a heavy price for making promises that quite frankly they couldn't deliver. Labour will be, in many ways, launching one final push to mobilise opposition to this bill. We want to drop the bill campaign, where organisations across the country are able to add their voice to that call. It's not too late to save the NHS from the chaos that will ensue if this bill passes. Jimmy, my eldest, was born at King's College Hospital 11 years ago, and was an emergency caesarean, and obviously that drastically then increases the likelihood that further births will be. So no, we're well acquainted with the challenges of maternity units and the intense pressure people work under, and forever be grateful to the wonderful staff that helped us through those difficult hours. I think probably my experience has shown me that balance in the system between really good quality maternity units with critical care facilities should they be needed, backed up by more home births, midwife-led units, is the right mix that we need, so that people are able to make a choice. But in those situations where you do need the emergency care, that it's of the highest possible standard, and that's absolutely been our experience of the NHS. We saw maternity services getting better with every child that was born. As I say, it was still great when Jimmy was born in the year 2000, but as the decade wore on, we definitely saw the slow improvement in maternity services. Just better one-to-one provision, a cleaner ward environment, a slightly less chaotic environment on the ward, all round just a more orderly experience, really, and a more personal experience. You know, it was clear to us that maternity services have genuinely improved. I am worried that the combination of the reorganisation with the financial challenge means that services are about to slip backwards, that we're going to see some short-term decisions taken because of the lack of grip and leadership in the system right now, that in certain parts of the country there will be random short-term decisions taken that will be cuts that damage the service in the long term. And yeah, I'm worried for where the NHS is heading. I would say that, you know, yes, the NHS does. There are difficult changes that the NHS needs, but much of it is rather than organisational upheaval, it is service change on the ground that the NHS needs, and it's that nettle that all politicians need to grasp. Well, we're talking about more specialisation where that's appropriate. We are talking about more services delivered closer to the patient's home in primary care settings. We're talking about doing more in the patient's home where technology allows that. You know, we can't, I think, kind of back away from some of those changes, even if they have implications for hospital services. I haven't, but thanks for putting me on the spot. I'll have a look at it, and if I can, then I will. I think she's absolutely right, and has been right over a period of time, to be honest, to raise this issue. She put considerable pressure on me when I was Health Secretary, and rightly so, because there is a very real shortage of midwives in many parts of the country, particularly London. And I recall having a very constructive discussion with Cathy about these issues, and we identified some of those trusts that face the biggest recruitment challenges. Now, the situation hasn't got any better since then. It looks like it's even got considerably worse, and already decisions are being made by trusts that will affect future recruitment, and there's been in parts of the country cuts to training places. Now, you know, that is worrying, and given the birth rate, given the the difficulties in parts of the country, it is right to raise the alarm about this. And having read the petition, if I can sign it, then I will. But I certainly pay tribute to Cathy and the RCM for the campaign that they've run on this issue.